how many of you know that lavender can treat burns? Terrific. How many of you know that the often recommended practice for putting citrus or any essential oils in water and drinking it as a refreshing drink is actually a very unsafe practice? Yeah, good. Unsafe. Unsafe. How many of you know that rosemary can enhance memory? So you've already learned something today. So wouldn't it be great to have a reputable source of essential oil information from somebody that not only practices aromatherapy, but understands the scientific basis of it? Today's your lucky day. Because I am that person, and today I'm going to talk to you. This is designed to be an overview of essential oil use. We're going to talk about safety. We're going to talk about the efficient use. We're going to talk about how to choose the right essential oil company. And we're going to go over the 10 essential oils, what I believe are the 10 essential oils for your basic home care kit. So let's talk about what is an essential oil. So the short answer is that it's the fragrant part of a plant, and it's extracted from all different parts of the plant. The flowers, the stems, the leaves, a variety of plant parts. In essence, it is the essence of the plant. And we ask ourselves why these naturally occur, and the answer is bees. That's the short answer of it. Essential oils are made of hundreds of compounds, very complex mixtures. And when combined, they make these fragrances, and these fragrances can be used in nature to attract bees for pollination. But it also can provide fragrances that can deter plant eaters. They act as herbicides, pesticides. So that's why they naturally occur. Natural selection has dictated it so, and so nature has provided us with these smells from plants. So the answer to question number 1 on your worksheet is that essential oils are the essence of the plant. See, I made it really easy for you. And so when you take into consideration all of the steps that are performed to produce an essential oil, and I'm talking about growing the plant, harvesting the plant, the chemical process of extracting the oil from the plant, right down to bottling, there is a lot of room for variation. It's because there's so many steps involved. So it's amazing that there is any sort of batch-to-batch consistency. And it's no surprise that there is company-to-company variation between essential oils. And this really calls into play why the quality of essential oils is so important. Now, a reputable essential oil company will perform a battery of tests to ensure quality control. And what's important here is that to know that there is no oversight as to the quality of essential oils. There's no government oversight. There's no dictating body that says this is a therapeutic quality. A lot of the terms that you'll see on essential oil labels, those are marketing terms, and they can be very deceiving if you're not an informed consumer. And so, again, the reputable essential oil companies will perform a battery of tests. And I've kind of shown some examples here. For example, organoleptic, which is a really kind of fancy way of saying you're observing the oil. And this is done by experts, but they take a look at the oil. They see if the oil is the right color, the right consistency, whether it smells right. Reputable companies will also perform bacterial tests to check for mold, fungi, bacteria, They'll also do heavy metal testing. This is to look for arsenic, lead, mercury, all things that you don't want within your essential oil. They'll also perform herbicide testing, pesticide testing. The fingerprint is there because some of the more complex analysis is performed with very large machines that do chemical analysis. And what it can provide you is it can provide you with the fingerprint of essential oil to see if there's any impurities within it. And this is a very complex analysis procedure done by chemists such as myself. And so, but you're going to see that, and the best essential oil companies are going to perform those procedures. So not all essential oils are created equal. This is the key to how you choose which essential oils are best for your use. So an informed consumer, such as yourself, will ask yourselves, has the essential oil been diluted in a carrier oil? Well, you'll be able to tell this in two different ways. If you take your essential oil and you put it on a piece of blotting paper or a tissue, essential oils are volatile, which means that they evaporate quickly. Carrier oils, or made of vegetable oils, they are not volatile, which means that they will not evaporate right away. And so if you take a tissue and you drop an essential oil on it and it's been diluted in a carrier oil, which makes it less expensive, you'll note that it will leave a stain on the tissue because it's been diluted in carrier oil. Another way that you can tell is if you take your essential oil and you drop it in water, it won't make the water cloudy. So it's another tell. We've already mentioned quality control tests and the battery of quality control tests that should be performed by an essential oil company. And because there's no oversight, it's up to you, the consumer, to do your research and see if that company performs it. Always use essential oils that are free of pesticides, herbicides, and heavy metals. A reputable essential oil company will be proud to give you that information. Understand that aromas that are copied from essential oils do not provide the same therapeutic effect as the essential oil in question. So I'm going to give you an example. Carnation essential oil has its own essential oil properties. It's not one that's used very commonly because it's expensive. However, if you combine black pepper and ylang ylang in the right combination, in the right ratio, it will smell like carnation essential oil, but it will not provide the same therapeutic effect. So it's something to be very conscientious of. The prices of essential oils should vary within the brand. So in other words, a bottle of lemon essential oil should not cost the same as a bottle of sandalwood. There should be price variation. The number one rule for choosing an essential oil company is obtain your oils from a reputable supplier, which just happens to be the answer to the next question on your worksheet. And there's lots of good essential oil companies out there. I'm not representing one. I have a list that I use, and with the right research, you will generate your own list. So let's talk about the different methods for essential oil use. You can see here, you can use direct inhalation onto tissue. You can put it in, you can do steam inhalation. How many of you have ever had a cold and put some Vicks Vapor Rub in a tub of hot water and then put a towel over your head and then you breathe in those fumes and it's ghastly, but it works. It's that steam distillation. Maybe you've got one of those diffusers. There's a shameless plug for my beautiful bracelets that I'm selling at booth 119. Stop on by. A massage, you can use it in the bath, cleaning products, skincare. We're going to talk about ingestion a little bit. You can ingest essential oils, but there's an appropriate way to do it. Safety is paramount, no matter which method that you use. And unfortunately, there's a lot of advice being given by otherwise well-intentioned individuals that's misinformation and actually can do more harm than good. So let's talk about one of the questions I asked at the beginning of this talk. Should you add essential oils to your water? If you add essential oil, lemon essential oil, to your water, which is often recommended, you will end up with drops of essential oil in water, just like that, just like what you see on the right. And the reason for that is oils and water don't mix. So if you swallow that, you can effectively do some damage to your esophagus or your stomach or your digestive system. So this is an unsafe practice. And it's often recommended, and I recommend against it for this reason. Just because it's natural doesn't mean it's safe. Ingestion can be performed if it's performed in a safe way. Now, it should be performed under the guidance of somebody with a background in pharmacology, specified towards essential oils. And just because somebody is a certified aromatherapist does not mean they've had training in essential oil ingestion. I just wanted to make that clear. There are very specific individuals who should be providing that information to you. Another application is topical applications, whether it's through massage, whether it's through skincare, anytime you're putting it on your skin. It should be diluted in a carrier oil. And carrier oil is a vegetable oil that's derived from the fatty portion of a plant. And what this does is it dilutes down the essential oil to a safe therapeutic level. It also provides you with the ability to give that essential oil the time to do its job, to react. And so that, now remember, essential oils are volatile, so they evaporate almost straight away. And so if you don't use an essential oil, you're not giving it time to absorb through your skin, through your system. And the carrier oil allows it to have time to absorb, which is when you want your therapeutic benefit, when you get your therapeutic benefit. So there's benefits to carrier oils twofold. Also, you're not, just putting essential oil on your skin. And so just neat. It's never a good idea. There could be skin reactions. Always use your carrier oil to dilute essential oils before you apply to your skin. Carrier oil would be the answer to your next question on your worksheet. So let's talk about storage just real quick. This dovetails onto safety. So the process where essential oils break down over time is caused by a process known as oxidation. And there are three things that speed up the oxidative process of essential oils, therefore making them go bad. Number one, oxygen. Number two, UV light, sunshine, light. And number three, heat. So it goes, if you protect your oils from these three elements, you will lengthen the time that your oils don't go bad. And there's three ways that you can do this. You can cap your oils tightly before use, thereby preventing it from being exposed to the air. You store it in amber glass bottles. This will protect it from UV light. And third, you can store it in your refrigerator or a cool cabinet, protect it from the heat. Oxidation is the process that breaks down essential oils over time. So now this is what you all came for. This is the 10 essential oils for your basic home care kit, according to me. Other experts have their opinions. This is mine. So let's start with number one. No, it should be nobody's surprise that it's lavender. Used to treat a variety of ailments from insomnia, anxiety, depression. Also used for pain, to treat infections. I would say 95% of my clients like lavender. There are some that don't. And with that said, one of the original published applications for lavender in the 20th century was by a scientist named Gattefoss. And he was working in his laboratory one day, and he burned himself and strategically applied lavender to his burns. And voila, it worked, treated the burns. And so using this, some variation of this procedure, he treated his burns with lavender and then wrote it up. And that's what he published. He ended up publishing that. And that was really kind of the start of the aromatherapy trend for the 20th century. Now, as we know, they've been using essential oils for ages. But this is really the birth of modern day aromatherapy as we know it. So just an interesting fun fact. Also not surprising, essential oil number 2 is peppermint. Used for, again, variety of ailments. Very stimulating, great for respiratory ailments, stomach problems, great for use in blends. I've got a lot of blends that I recommend a lot of blends that incorporate peppermint into it. I've got one of my clients has cancer. We work with some blends to help with her chemo-induced nausea. Very effective. And also effective when used in conjunction with lavender. They work synergistically or with each other to produce a great headache relief blend, which I'm showing you here in this recipe. Basically, you see that I'm diluting down both lavender and peppermint in a roller bottle with a carrier oil and applying it to your temples. And for most people, this is quite effective at getting rid of a headache. And so it's very easy to make. You don't need to be a chef to make it. Essential oil number 3, tea tree. The best, one of the most effective antifungal components are within tea tree. That's its main use. Great for athlete's foot. As a result, great for athlete's foot, ringworm, candida. It's also used in a lot of sunburn recipes. Very well known in acne treatments. Great for topical use. Number 4 is lemon. And one thing you have to consider with citrus essential oils is that we talked about oxidation. They oxidize quite rapidly. And that's because of its chemical makeup. So it's very important to protect lemon or any citrus essential oil from the components that speed up oxidation, which includes air, heat, and UV light. It's used for a variety of ailments. Also, it should never be applied to your skin neat. And the reason for this is because if you do that, if you go outside, if you apply lemon to your skin, you go outside, you will more likely burn because people are very prone to photosensitivity. And you really have to be careful with lemon essential oil, topically applied. Really any citrus oil, but still very effective for such a variety of different ailments, including my athlete's foot remedy, which includes tea tree oil, lemon, a bit of lavender, good to use between your toes. And and now that summer's coming and we're all wearing flip-flops and sandals, you really want to try and get rid of that athlete's foot if you have it. And so this is a great recipe for use on that. Okay, number 5. And now we get to the ones that are not as commonly used, and you may not have in your repertoire already. But number 5 is Roman chamomile. And I'll tell you, Roman chamomile is one of my favorite essential oils. And I will tell you why. I don't know anything I can't do. It is a great anti-inflammatory. It has some very powerful anti-inflammatory components. It's virtually safe for virtually anyone to use on their skin. Terrific for muscle sprains and strains. Very good for anti-anxiety, nervousness, and insomnia. One of my favorites for insomnia, and that's why I've included it in my insomnia remedy. And I actually use this every night. And all you do is take 3 drops of Roman chamomile, 3 drops of lavender. They work together quite well. I used to be quite dependent on muscle relaxers to go to sleep due to my health conditions. I'm now off those, and I just diffuse this at night. And I'll tell you, it works every time. Now, I cut it with lavender because I don't particularly love the smell of Roman chamomile on its own. So I like to blend it. You don't have to just try Roman chamomile. It's all really personal preference, and everybody's going to react to oils differently. So, but yeah, this is a must-have in my collection. Number 6 is geranium. Geranium's used in a lot of skincare products, great for acne. And I have it in one of my blends that I can't even keep in stock that I sell. I combine geranium and pomarosa, and what that provides is an anti-anxiety blend that doesn't give the sedative effects of lavender. So, I mean, there are a ton of terrific treatments that geranium can provide. And that is because it has, again, powerful anti-inflammatory components. Also can be used in lip balm, who knew, right? So you just combine chamomile oil and geranium oil. You can get some aloe vera gel from anywhere. Makes great lip balm. Again, summer's coming. You want nice lips and nice feet. Number 7 is eucalyptus. And now we're back to the ones where you're like, oh, you got to have eucalyptus in your collection. Most commonly used for colds and flu. This is one you want to be careful to use around children. It can be used, there are dilutions that can be used for children if you're nervous about using it around children. A great alternative is cedarwood. But in young children, it can cause central nervous system damage if you have it right near their face or near their chest. And so it's best to talk to a pediatrician before you use it with children. But for adults, certainly if used at the appropriate dilution, it's great for colds and flu, respiratory problems. Also used for wound treatment. I didn't realize that. And it's a component in a lot of natural insecticides. Number 8 is thyme. Thyme, there's been a number of studies fairly recently where they've used thyme to treat chronic fatigue syndrome, which I found quite interesting. Great for increasing your circulation. People with low blood pressure are often treated with thyme. Also done for nervous anxiety, insomnia. Again, the list goes on and on. This is a great natural cough remedy where you're combining eucalyptus and thyme and carrier oil. Great for massaging on your neck, chest, back. It's great for those really dry, unproductive coughs where nothing's coming up. Your chest hurts so much. So yeah, thyme is a great component for that. Number 9 is rosemary. And I like rosemary because it not only helps with respiratory issues, headaches, and they've done some studies where they've performed it in children with learning and memory issues. That's something I'm going to show you right now. Actually, this is great. So sniffing rosemary can enhance your memory up to 75%. And this was some research that was performed fairly recently in England, where they had children smell rosemary and take tests. They've also done it with older patients as well. But the implications of this research are huge. This can be used to study the use of rosemary with patients with dementia or Alzheimer's, school-age children. I mean, this is huge research, and this is something that we should be following up with. And hopefully we will in the future. But it's something that it's easy enough that you can try at home. All you have to do is smell some rosemary. Try it. Number 10 is clove. Clove is most commonly used for respiratory issues, muscle pain, and dental pain. It's commonly used in dental pain. And here's a great recipe, again going back to steam distillation, where you're combining thyme, tea tree, lavender, and clove, putting it in a hot bowl of hot water and putting a towel over your head and breathing it in. Close your eyes because you don't want it to hurt your eyes. Lift up the towel if it's bothering you too much, but this is great for getting rid of congestion during colds. So let's talk about the things we learned today. All essential oils not created equal. Think of quality control tests, so important. Do your research before you choose an essential oil company. Safety is paramount no matter what application method. Pay attention to what is recommended for topical applications. Consult an expert for ingestion. And finally, you learned what I think are the 10 most versatile essential oils for your home health care. Pretty good. So I'm introducing myself. My name is Dr. Jessica Norris. You can call me Dr. Jess. I started out making bracelets. Shameless plug for my bracelets. They are essential oil bracelets, and this kind of extrapolated into aromatherapy and wellness educational services. Now, how did this happen? About 7 years ago, I went, in a matter of 6 months, I went from being somebody who worked for a startup company that was working 70 hours a week with my PhD in chemistry. And within 6 months, I had had a baby, lost my father, became the primary caregiver to my mother with multiple sclerosis, and was myself diagnosed with multiple sclerosis in 6 months. And it really caused me to take a good long look at my wellness. And a doctor had recommended that I said, well, I was starting to lose the dexterity in my hands. I'll make some bracelets. Take up a hobby. Use your fingers. So that's how Doobie Doobie Doo was born. But I wanted to do so much more. I wanted to offer my expertise. I've been practicing for about 7 years, around the time that I was diagnosed. I'm doing pretty well. And it's all about changing your life. So that's why I started my educational services. So what can I offer you? I can offer you free, if you follow me on Facebook, I have free Facebook Live presentations, a lot of infographics, very similar to what you see here. If you sign up for my newsletter by going to my website, you get a PDF version of a lot of the recipes that you've seen here today. I do webinar courses, and I do one-on-one virtual consultations. So in other words, we'll talk on the phone or we'll do a video chat. And if you come to my booth, I would be happy to schedule a free 15-minute one-on-one virtual consultation. And we'll discuss in a little more detail what advice I can give you. I'm not a medical doctor, and you should always consult a medical doctor. And I feel obligated to say that, but I have a lot of knowledge, and I'd love to share it. And I feel like you'd love to learn it. Having said all that, I leave you with this quote, and I've received a lot of guidance from a man named Robert Tisserand, who has written the safety manual on essential oil. And if you haven't ever seen it, you should definitely take a look at it. It's not light reading. It is a textbook, but it gives some very important information on contraindications with different medications, as well as safe therapeutic levels for topical use. And so aromatherapy is a caring, hands-on therapy, which seeks to induce relaxation, which we could all use, to increase energy, to reduce the effects of stress. Of course, some of you might not have stress. I do. And to restore lost balance to mind, body and soul. And with that said, I thank you all for your attention. And be happy to answer any questions you have. Appreciate it. Yes?
A little discussion on that rosemary. If it's supposed to be so conducive for helping with memory, but it doesn't do anything for IQ or anything like that.
No, I don't think they've looked into that, to be honest. I think they were looking into it for, I think the initial studies were
So it's
for older patients.
for memory, and so for something happening in the mind of someone with dementia or something, it finds a different kind of a pathway or something, or reduces.
I don't know that they understand the mechanism.
Yeah.
They just know which parts of the brain it activates, and you know, it's unfortunately the only studies of the kind were the ones that I've mentioned. Now, why they haven't taken that and run with it to find out why this happens.
I missed the part about you having MS. Have you been able to treat yourself with something?
Yes and no. I've tried different things. So with essential oils are very much like medicines, and hence the title Medicines of the Earth. And what works for one doesn't necessarily work for others. I have a massage therapist that incorporates some essential oils into practice with me. I've had some success with basil. I've started looking into several essential oils for neuralgia. One of the issues that I have is facial neuralgia. It's a lot of trial and error. And the insomnia was a big one, because I have one of my issues is the spasticity was keeping me up at night. Now, I haven't found something to treat the spasticity, but I found something so that I wouldn't have to take muscle relaxers and I could get a good night's sleep.
Right.
So what you're ending up doing is, I'm not curing MS, no way, but I am alleviating the symptoms so that I can have a more productive life. And that's what it's about for me, until there's significant research done that says if you take this, you will cure MS, right? I mean, and that's not going to happen anytime soon. But what I can do is know what works for me, and it's a lot of tweaking. And I'll tell you that insomnia has saved my sanity, because and not only do I fall asleep, I get quality sleep. And because I get good sleep, my symptoms don't manifest the way as severely as if I didn't get a good night's sleep. And so MS is a complex disease anyway,
Right.
but I've found things that work for me. If that answers your question. If anybody has any other questions, please. Oh, go ahead. Yeah, sure.
So
We have one more.
in my notes, for the respiratory and rosemary. So for a child, I mean, you might be the advisor or
Right.
whatever, but like using a vaporizer, maybe I have a little cup of a vaporizer or a big vaporizer.
Yeah.
Maybe a little water in a drop or oil or something in a drop.
I'd actually have to look at it. Offhand, I can't remember, but yeah.
That's not a bad idea.
Right, and so again, the most important thing is to balance the risks versus the benefits. And there are essential oils. There's a list of essential oils that should never ever be used around children.
Right.
And then there's essential oils that should be used sparingly around children. And then it depends on the age.
Yeah.
Right? So, and I've not got everything memorized, but just understand that there's always risks involved. But if the benefit outweighs the risk, Again, it's all about making an informed decision, not doing just what an essential oil rep tells you is okay. Understand why it's okay.
Right. Yeah. Okay.
Yeah. The essential oil bracelet. Always worried that it would contact your skin and cause irritation.
And because of that, I always recommend dilution. So I dilute. I sell some blends, and I dilute it down. And yes, you can irritate it if you have a sensitivity to it. You can get irritated, and that's another reason why you want to avoid putting it on your skin neat, especially over long-term usage, because anyone can develop an allergy through skin sensitization at any point. And the more you use it neat on your skin, the more likely you will develop an allergy. And once you develop that allergy, you can't use it on your skin anymore. And so you want to be careful of that. So I always recommend diluting, even on the bracelets. And you don't even need full strength on the bracelet. I mean, if you dilute it down even 25 to 25%, that's 4 drops on a bracelet is 1 drop is equal to 1 drop. And so you're covering more surface area. I mean, it's safer and it's cost effective. And if you use it often enough, it's definitely cost effective. And for diffusers, so somebody had asked me earlier that there was the issue of, is it safe to perform aromatherapy in a room if you have pets? And the answer to that is yes. Dogs, if you do it properly. Dogs are less of an issue than cats. Cats are very sensitive to essential oils. If you're diffusing it in a room, just make sure that it's well ventilated, that the dog can leave or the cat can leave the room at any time. When you start topically applying essential oils to animals, that's a different story. And with cats especially, it's often not recommended because they are so sensitive. But as far as your practice in your room, in a diffuser, you should be okay unless it's this tiny little room and you're putting 50 drops of essential oil in your diffuser. That's not how you perform aromatherapy. Even that's going to give you a headache. And if it's going to give you a headache, think of what it's going to do with your dog. So just remember, even diffusing needs to be done properly. Your typical size bedroom with your typical diffuser, the rule of thumb is no more than 6 drops in a full tank of water. If you're doing more than that, you're pretty much wasting oil and you might give yourself a headache. Yeah. So do it properly. Pets will be safe, you'll be happier. That's it. Come on. All right, thank you all so much. And if you'd like more information, come on down to my booth. Shamelessly plugging my bracelets again. Booth 119. Thank you very much.